The notion that vaccines make you weak and sick is a misconception that has been perpetuated by misinformation and a lack of understanding about how vaccines work. Vaccines are designed to stimulate the body's immune system to recognize and fight off specific diseases, thereby providing immunity against future infections. The idea that vaccines weaken the immune system is not supported by scientific evidence and is often based on a flawed understanding of how the immune system functions. Some people argue that vaccines contain harmful ingredients, such as mercury and formaldehyde, which can cause sickness and weakness. However, the amounts of these ingredients in vaccines are extremely small and are not enough to cause harm. In fact, the benefits of vaccination far outweigh the risks, and the ingredients used in vaccines are strictly regulated by government agencies to ensure their safety. Another misconception is that vaccines can give you the very disease they are meant to prevent. While it is true that some vaccines, such as the flu vaccine, contain live or attenuated viruses, these viruses are weakened or killed and cannot cause the disease in the same way that a natural infection would. The risk of contracting a disease from a vaccine is extremely low, and the benefits of vaccination in preventing serious illness and death far outweigh this risk. For Christians, the decision to vaccinate or not can be a complex one, especially when faced with misinformation and conflicting opinions. However, many Christian denominations and organizations have spoken out in support of vaccination, recognizing the importance of protecting human life and preventing suffering. The Bible teaches us to love our neighbors and to care for the vulnerable, including children and the elderly, who are often the most susceptible to serious illness and death from vaccine-preventable diseases. Christians can take several steps to make informed decisions about vaccination. First, they can seek out credible sources of information, such as the Centers for Disease Control and Prevention (CDC) and the World Health Organization (WHO), which provide accurate and up-to-date information about vaccine safety and effectiveness. They can also consult with their healthcare providers, who can provide personalized advice and guidance based on their individual health needs and circumstances. In addition to seeking out credible information, Christians can also take steps to promote vaccination within their communities. This can include organizing vaccination clinics and events, providing education and outreach to parents and caregivers, and advocating for policies that support vaccination and public health. By working together to promote vaccination, Christians can help to protect the health and well-being of their communities and uphold the values of love, compassion, and care for one another. It's also important for Christians to recognize the role that faith can play in promoting vaccination. Many Christians believe that their faith is a source of healing and protection, and that God has provided us with the gift of modern medicine, including vaccines, to help prevent illness and promote health. By embracing vaccination as a way to care for one another and to promote the common good, Christians can demonstrate their commitment to loving their neighbors and caring for the vulnerable. In conclusion, the idea that vaccines make you weak and sick is a misconception that is not supported by scientific evidence. Vaccines are a safe and effective way to prevent serious illness and death, and they play a critical role in protecting public health. For Christians, vaccination is not only a matter of personal health, but also a matter of faith and values. By seeking out credible information, promoting vaccination within their communities, and recognizing the role that faith can play in promoting vaccination, Christians can help to protect the health and well-being of their communities and uphold the values of love, compassion, and care for one another.